and welcome to another segment of Interviews That Matter. I'm your host Raj Mehta. Friends, in this segment we bring those guests who influence our lives. This includes elected officials, policymakers, heads of major organizations, and other dignitaries. It is my sincere hope that the knowledge brought in by these guests will help our community. Continuing with the CEO series, we have today CEO of the largest hospital system in the country, North Shore LIJ, Michael Dowling. Mr. Dowling, thank you so much for coming, sir. Really appreciate your time today.
Pleasure to be here.
And it's an honor to be here with sitting with you. And normally, a lot of people, we have in our community, we have a big healthcare related, community members, from us. So most of the people know you by name, and some of them know you more than some of them less. So I want to hear from you, actually, your background. You came from Ireland. Let's start with that.
Yeah, I grew up in Ireland, in Southern Ireland. I grew up in a farming community. We ourselves did not have a farm. And Ireland in the 1960s was, in many ways, like a third world country. There wasn't much there. The situation when I grew up was, it was not great. I mean, there wasn't electricity in our area, anything like that. And so I went to high school in Ireland, but I always wanted to go to college. And getting into college in Ireland was very, very difficult back then, but I did my best to try to get into college. But I knew that if I got into college, I had no way to afford it. We had no money. And my family situation, my father, suffered from arthritis, so he had to stop working. And so I initially went to England, working in steel factories when I was 15, 16 years old. And I'd do it for a couple of months, and I'd make enough money to help out at home. And then when I was able to go to college, I had to figure out where do I go to get money to help me to go to college. So I came over here to the United States. And I came here first in 1968. I worked here for 3 years. I would spend close to half of the year working here. And then I would go the second half of the year, and I went to my undergraduate college in Ireland.
Oh, wow.
So
so you work here and you go to Ireland, back to Ireland?
College, yeah. I'd work here from like May until October.
Right.
I'd go back to college, did it for 3 years. I worked down on the docks on the west side of Manhattan. And then I had never intended to stay in the United States. So I got my college degree. I came back here. And then I ended up staying. So I worked on the docks, I worked in construction, I worked as a plumber. I went to Fordham University.
Okay.
I got my master's degree at Fordham. Did a whole variety of jobs. I mean, back then you would, do anything. You wanted to make money, so you did whatever it took to make money. It was, in many ways, it's the immigrant experience.
Right.
Like so many others, and so many of the people that you know who came here and then in many ways worked very hard, but also get lucky. Luck is a big part of it as well. You're in the right place at the right time. So I ended up going on faculty at Fordham University. I went to Fordham and I went to Columbia.
Okay.
And I started to teach at Fordham part-time, and then they asked me to teach full-time.
Oh, okay.
And then they asked me to come on administration at Fordham. I was the assistant dean at the Graduate School of Social Service at Lincoln Center.
Oh, okay.
And they had a campus in Westchester at the time, and they asked me to head up that campus in Westchester. So I did that. And then in 1983, Governor Mario Cuomo got elected governor. I did not know Mario Cuomo back then. And I hadn't been involved in politics much at all.
Okay.
But after he got elected, his people reached out to me to ask whether or not I would be interested in joining the administration. I had done some work, but I hadn't been involved too politically. So I ended up going to Albany. I planned to go for 1 year. I went to Fordham and I said, I'd like to take a year off. And the president of Fordham was very helpful. Take a year off, go to Albany. It was new, it was different. I didn't have any experience. I figured, well, it will be good to do this. And then the Fordham president said to me, you can come back. If it doesn't work out, come back to Fordham, your job is okay. I went there and I ended up staying 12 years.
Wow.
And I started out in the Department of Social Services. I was the deputy commissioner. And then I got promoted to being the deputy secretary to the governor, which is like his deputy chief of staff role.
Okay.
And then I became head of health and human services for the state of New York for many years, and a very close advisor to the governor. His office and mine were almost next door to one another. And then I became commissioner of social services, which requires that you get confirmation by the state Senate. So I had to go through the Senate confirmation process. And I stayed with Governor Mario Cuomo from 83 till 94. And at the beginning of 95, I left. I mean, he didn't get re-elected at that point. And then I was very fortunate because I had a number of people offering me jobs. So I was one of those very fortunate people. I didn't have to go looking for work. I had people coming to me.
Wow.
And I ended up going to Empire Blue Cross Blue Shield. And I lived in Albany at the time because I had moved, my wife and I moved to Albany with the kids when I was working in Albany. And Empire Blue Cross gave me the opportunity to work a number of days a week in Albany and a number of days a week in New York City. So I was able to go back and forth.
Both back and forth, right.
I stayed there for a while. It wasn't really for me. The insurance business wasn't for me. And then North Shore University Hospital, the CEO there, a guy named Jack Gallagher, reached out wanting to know if I would be interested in coming to North Shore. And that was at a time when North Shore was thinking about expanding and creating a large system of multiple hospitals. I went to North Shore, and I came in basically as the chief operating officer. And then we added lots of hospitals. We merged with Long Island Jewish, so it became North Shore Long Island Jewish. And then in 1981, sorry, not in 81, in 2001.
2001, right.
In 2001, I became the CEO. And so obviously we've expanded, we've grown much larger since. So it's been an interesting transition. If you had asked me back when I was in Ireland, back in those days, if I would be doing what I'm doing now, I would have said to you, you're crazy. There's no way I could do that. So you never underestimate what can be done. I mean, you take risk. I took risk. I wasn't afraid to try something new.
Exactly.
I wasn't afraid to dive into something I knew nothing about. And you learn. And it's been a very, very interesting ride. Very, for me, very successful. You've learned a lot. You continue to learn all of the time. I mean, it's never static. So that's a kind of a quick snapshot. My whole family is still in Ireland. My parents have passed away, but my brothers and my sister still live in Ireland. None of them ever came over here permanently. I go back to Ireland, twice a year. I do. Right now I go back a little bit more because I'm very involved in the healthcare stuff in Ireland.
In Ireland also.
I'm involved with the Prime Minister's Commission on Health, and so I go back and forth a little bit more now than I did the last couple of years. And it's easy. It's not a long, I can get to Ireland faster sometimes than I can get to my hospital in Staten Island. I mean,
there you go.
Get stuck in traffic out here, you might as well go to Europe. It's
Right.
quicker,
Not a bad idea.
Yeah. So that's like a kind of a quick snapshot. So I've been lucky and I've been very, very fortunate.
Let me ask you one thing: that do you still do plumbing at your house?
I've actually done, in the not in the last couple of years, but for years and years I did all my own stuff. I did my own carpentry, my own plumbing, my own construction.
Wow.
I don't get time anymore, but I still like to, I do a lot of work around the house. I mean, I have large hedges in front of the house. They're like 8 or 9 feet high. I cut my own hedges. Everybody says to me, what are you doing cutting your own hedges? You're going to fall off the ladder. You're stupid. But, I enjoy the physicals. And I enjoy the physical work. You know, at least when I cut the hedge, I can look back at it and say, I did that.
There you
know?
go. There you go.
Because in a lot of the stuff we do every day, we work very, very hard, but it's very hard to put your finger on something that you can see at the end of the day that you accomplished.
That's exactly what it is. That's the satisfaction that you get, right?
So if I put in a sink, I can say, I know, look at it, I put it in.
There you go. There you go.
Yeah, I don't have the tools anymore, but yeah, can I do a lot of that stuff? Yes. I won't shy away from physical labor. That's not a problem. It's actually good. It's healthy. You know, it's very, very healthy.
2002, when you became you started as CEO in
Yes.
2002, right? As a CEO, what was then, and what is now? Like
We
you were
are-
one hospital at that time.
No, we had many hospitals.
At that time?
Yeah, at the time we had about 11 hospitals.
Oh, okay.
You know, when I got there in Tenochtitlan in '95, we had 4 or 5 hospitals.
Okay.
Then we added a lot of hospitals, you know, from that period to 2001, 2002. And a big merger, of course, during that period, before I became CEO, although I was very much involved in it, was the merger between Long Island Jewish and North Shore.
Oh, okay.
So today we're well more than double the size that we were back then. We've expanded dramatically and continuing to expand. You know, healthcare has changed a lot. The business has changed. You know, how we get paid has changed. So you have to be innovative. You have to keep moving. You can't stand still. You know,
Right.
as you know, in the business world, if you stand still,
Then you're done.
you fall behind.
Yeah, that's it. Yeah.
You're just done. You gotta
Yep.
keep moving forward.
Keep
and
moving forward, right?
trying new things.
So when you know, I mean, I'm just kind of want to understand from you that Governor Cuomo, when he
Yes.
became governor, he picked you.
Yeah.
And you said you were not involved in government, or I mean,
No.
do you know why and how? Well,
there were people in his administration that
They must have known
knew
you.
a little bit about me
Right.
because I'd been involved a little bit in the policy development and in policy issues. They were reaching out for people to come into the administration. I had done some work on the welfare area. I'd done some work on employment issues. I hadn't been involved in politics, you know, election type of stuff.
Right.
But I had been involved in some other policy issues.
Oh, okay.
And I was surprised. You know, when I asked myself the very same question. When I got called, I said,
Right.
how did my name come up?
Exactly.
Why me? And you know, maybe they needed somebody with an Irish accent. I don't know. They needed diversity. They needed somebody with an Irish accent. So, you know, when I went to Albany, I became the deputy commissioner of the Department of Social Services, which is one of the largest departments in the state.
Right.
I didn't know much about Albany.
Right.
I wasn't familiar with it. I didn't know much about the department. I know what it did, but I didn't know any of the detail. But that should never stop you from doing something.
No,
I mean,
of course not. Yeah.
You
I mean,
go
you got
in,
an
you look at
opportunity.
it, and you say, well, I can do this. I can
Yeah.
figure this out. This can't be that difficult.
Right. Right.
And you work hard at it, though. You know, really, really study, and you work hard, and all of a sudden, you realize, oh yeah, I can figure this out. It's not as difficult as people may lead you to believe.
You are absolutely right. I mean, you know, I'm also an immigrant, and obviously, you know, when you come into this country, you work hard and you just take some risk,
Yeah.
and you can make it.
Well, you know, the immigrant experience is amazing because, you know, coming to the country is risky in itself.
Exactly.
You
Right.
know,
Yeah.
So, it was easier for me in a lot because I had the language. I spoke the language. I mean, I have an awful lot of respect for people that come from whatever part of the world is, and the language, they don't have the language. They never got to learn the language.
Right. Right. Right.
So we all spoke English in Ireland. You learn Irish, Gaelic, you learn the Irish language, but you never really used it because it wasn't useful, other than knowing it because it's your national language. But everybody spoke English. So when I got here, the fact of coming here was risky. When I got here, I wasn't sure exactly what I was going to do.
Right. Right.
You had to go looking for a job.
Right. Yeah.
So when you go through that, other things become a little easier. You know,
Right,
it's like,
right.
so I have to take a job over here that I may not know much about.
Right.
If it doesn't work, I'll try something else.
There you go.
So, you know, there's a lot to be said for that you know, the characteristics of people who come from from other parts of the world here. I have enormous respect for the first generation immigrants.
Right.
And in many ways, you know, if everybody's honest about it, I mean, the United States was created by first generation immigrants and still is.
Still is, right, exactly. Agree with you. Yeah.
Yeah.
Yep. So let me talk about some of the, you know, because this is a CEO show, right? So I want to talk about your role as a CEO, and you've done tremendous, successful, largest enterprise hospital in the country, probably. You know, one of the largest.
We're the largest in New York State. We're the largest employer in New York State.
Largest employer in New York State, right? So you basically are a visionary leader in my mind, okay? And you're called a visionary, the greatest visionary leader in the healthcare industry, right? Enterprise, right? So tell me something that what it takes to be a leader.
Well, to me, leadership is about challenging the status quo. It's about looking forward. It's about looking 5-10 years out. And in many ways, it's about creating the future. It's like looking at where you are and saying, well, I can sit and I can just manage what we have.
Right.
Or I can think about where we should be 5 years from now, a decade from now.
Right.
So you may not have all the details clear in your head,
Right.
but you have a pretty good sense that you know, that the world is going to change, and you want to be at the cutting edge of changing that world. I mean, a leader also is somebody that doesn't always respond to events. They get ahead of events.
Right.
You go there first.
Right.
You try things first.
Right.
You're not afraid to fail.
Yep.
You know, you're not risk averse. I mean, some people get catatonic. You know, they see an issue, they see a problem, and all of a sudden they freeze. They can't figure out how to do anything about it because it might not work. Well, that's okay. If it doesn't work, you change tactics.
Exactly.
And you move.
Exactly.
And so in many ways, it's about, you know, looking at everything that you do and saying there has to be a better way to do it. And then guide the ship forward, you know. Get ahead of it, get ahead of the trends. Watch what's going on nationally and internationally. You get a good sense of the direction, and not be afraid to move forward. I like taking risk. I don't want to. You know, I don't believe in taking totally stupid risk.
Right.
But if you're not in some kind of level of discomfort all the time, you're not moving forward in a new way. You know, if you're very comfortable.
Right.
You're not challenging yourself.
Right.
And so I think leadership in many ways is about that. It's also about making sure that you have followers. You know, that whatever you do, that people are willing to follow.
Right.
Not because you make them follow you, but because they want to follow you. No, it's no good being a leader if you go out front and you look back and there's nobody behind you.
Nobody's behind you. I was going to ask you that because team is the key, right?
Yeah, pardon?
Team.
Oh yeah, it's all about team.
Right.
It's about picking the right people.
Yeah.
It's about giving those people freedom to do things within large boundaries. And it's also not being afraid to dive into the detail. You know, you dive in, you dive out. You know, because you've got to be close to the operations as well. You just don't forget about the day-to-day operations. I mean, you have people doing that, but you can't be totally disassociated from it. Otherwise, you're living in a dream world out there, and that doesn't make sense either.
So you know, I mean, give a responsibility or verify it.
Yes,
Something like that.
Yeah, you give responsibility. You give the freedom to people to do things. You point the direction. You say, look, I'm going here. And that's where I go. Now, you got to be willing to listen to people who may have a contradictory point of view, who say, well, I'm not so sure. You know, you have a kind of a participatory focus. You get people involved. You know, convince people that this is the right place to go. They may convince you otherwise on some circumstances. But always forward moving, never static. Managers, the difference between leadership and management in many ways, managers in the the traditional definition of managers, you manage what is. You keep the schedules on time,
Right.
the dates are met, etc., etc. But you're managing this. The difference between that and leadership is that leadership is managing this plus moving forward.
First moving forward.
You
right.
got to do both.
Right, right. Yeah. Now, when you are in a large system, that's a very different world than a small
Yes.
place, right?
Yes.
So obviously, large system, whenever let's say you decide to, 5 years from now, you want to acquire 20 more hospital, 10 more hospital. For that, you need a lot of resources, in terms of financial resources and all that.
Right.
So for that, obviously, it may be easier for large enterprise like you
Well,
versus a small.
yes, but remember we were small ones.
Right.
So you only get, you only get larger after making judgments about how it is you need to expand from being a place that was small. I mean, it all started with North Shore Hospital was one hospital.
Right.
So when it started out, it was North Shore. And then other hospitals over the years were added. Some of the hospitals that were added were losing money. They were not doing well, so we were able to fix them. And then you grow. And then you realize, okay, there's an opportunity arises to get this place over here, and you go get this place. And you do it for the right reason. You got to make sure that you're growing for the purpose of providing better care to the community, especially in the healthcare arena. You just don't grow for the sake of getting big. I mean, I'm not interested in just getting big.
Right.
I'm interested in using scale to be able to do things I otherwise can't do or couldn't do. And you obviously have to have the financial resources.
Right.
As you know, you've got to be able to make the money to do it. You've got to be able to borrow the money. You've got to have a good balance sheet, etc., which we didn't have at one time. Today it's much stronger. And some things you may want to do, you decide, I'm not going to do it now, but I'll do it 2 years from now.
Right.
And at other times you have to do something now, because if you don't do it, somebody else does it.
Somebody else does it. Always.
So
Always.
there's always an opportunity, and you
Right.
say, well, I'm not this is not the greatest time for us to do this, but I have to, because if I don't, somebody else takes it, and then I will look back at it and say, that was a stupid thing that I did. I didn't move when I should have moved.
Right.
So you stretch the organization. And when you're stretched, you do good work, people have a lot more capacity than they think.
Absolutely.
Everybody can do more than they think. Everybody will say, well, I'm so busy, I can't do any more. I don't believe that.
Yeah, right, yeah. It's
So
always.
This is why in most organizations, if you have something very important to do, you give it to the person who's very busy.
Right, of course.
And you do that because the busy person figures out how to do it.
Right, yeah.
And the person who has nothing to do, you won't give it to, because the reason it has nothing to do is he doesn't get it done.
Right. Yep, agree. In hospital, like you have two major pillars. One is the administration and one is the caregiver. Now, it's very difficult. I mean, it's very important to have a balance in between.
Well, we have a number of very big hospitals. You have North
Right.
Shore, you have LIJ. We got
Right.
huge hospitals in Staten Island. We got Lenox Hill in Manhattan. We've got Southside out on the east. Those are big places. And then we got smaller hospitals. But it's also important to realize that we have a lot more than just hospitals. In fact, the biggest part of our system, the fastest growing part of our system, is not hospitals anymore. It's outpatient ambulatory care.
Oh, okay.
It's facilities that deliver health care that are not hospitals. I have 400 of those.
Oh, okay.
Yeah. Everything from urgent care centers that you'll see on the street to very large facilities that have no beds in them, to freestanding emergency departments, to hospice facilities, home care, nursing homes, etc. So people focus an awful lot on the hospitals because they're very visible, they're big.
Right.
But healthcare is changing so much that so much of what was once done in a hospital can now be done outside the hospital.
Right.
Most surgery doesn't need to be done in a hospital. Cancer services are mostly done outside the hospital anymore. So we're moving programs from inside the hospitals out all the time. That's one of the huge changes that's going on in healthcare. So if you needed shoulder surgery,
Right.
5 years ago, we would take you to the hospital. We would spend 2 days there. Now I can take you to one of our ambulatory sites, take you in the morning, do the shoulder surgery, and have you home in the afternoon.
Okay,
don't
so
ever go near
you
the
don't have to go to hospital.
Yeah.
Yeah.
No.
And I guess LIJ is also kind of acquiring small practices also. A
Well,
lot of
we're
small
requiring,
practices.
yes, we now have about 3,000 physicians that are on some kind of salary with us. But we also have another 12,000 physicians out there
Oh.
that do business with us, but they're not paid by us. So you have private physicians that have a relationship with the hospital. Then you've got physicians that are employed by the hospital. And we have, of course, I don't know, 11, 12,000 nurses. I met with about 300 of them this morning.
Oh. So that, how do you manage 60,000 people?
Well, it's not, you put the right structures in place, you hire the right people,
Well, that's,
and you got to spend a lot of time making sure you hire the right people. You select the right people to run the various facilities. We train a lot of our own people. So I know all of our leadership at all levels very, very well. If I pick one of them to run Long Island Jewish, I don't have to worry too much. These are strong people. I know them. We've trained them. They will not do anything. They won't make. It isn't that they won't make a mistake, but they won't make a stupid mistake. You can trust them, and once you can trust, and once you understand their loyalty to the organization, not necessarily just loyalty to me, but loyalty to the organization,
right.
that they always want to do the right thing, that they don't cut the corners to do something that's not right, then you can sleep. And you have the, and you know what they're responsible for, they know what they're responsible for, you hold them accountable. And I don't look upon it as this big thing. I mean, I'm very involved,
Right.
so I've been involved since the beginning, so I know every part of it. I've been involved in recruiting almost all of our leaders, so I know all of them.
oh, okay.
So I can go to sleep knowing that if there is a problem, I get called.
Okay.
If I don't get called, they have the competence and the ability to fix it.
Okay.
So, yeah, it looks large, but and it is large, but it's a lot of work. Don't get me wrong. It's long
It's
days.
a lot of work. That's,
Yeah.
I'm saying,
It's long
probably
days.
23 hours in 24 hours.
Yeah,
something,
most
you know,
of
I
us
mean, a lot
will
of-
start. I mean, I'll have meetings every morning, 6:30, 7 o'clock.
Yeah.
Every morning, and you're pretty much going all day. You gotta make good use of your time. You can often spend a lot of time doing a lot of foolish things that waste time. And if I get home at night, 8 o'clock, 9 o'clock, that's pretty good.
Wow.
And I work on the weekends. During the weekend, Saturday and Sundays when I do paperwork. Because I don't like just sitting in the office. I like to be out meeting
there,
with staff, out
meeting
on the
with people.
floors. You want to be visible.
Right.
So on the weekend at home, I will do most of my paperwork. Saturdays and Sundays.
Actually, Mr. Bergman, he was here on the guest on our
Yeah.
show, and he's the CEO of Henry Schein, and he said you got to wear rubber boots.
Yeah.
That's
I know
exactly what he says.
I know Stan Bergman very, very well. He's a great guy, fabulous
Right.
guy.
Yeah.
I like him. He's also got an accent.
Right. It's South
But he
Africa.
runs a great company, and
Yes.
he's a wonderful member of the community. Very, very well.
Yep.
But you've got to love what you do, which is another thing. I mean, if you don't like this, it's hard to do.
You got to like it.
Yeah, you've got to like it.
Yeah.
You've got to live it.
Yeah.
You've got to believe in it, and then when you love it, it's not work.
Right.
So people
right.
ask me, because I don't think I have a job. I mean, it's a vocation. It's an obligation, and so to me, if I wasn't doing this, if I wasn't working doing this, I wouldn't know what to do. So to me, it's not difficult. Sometimes you run into issues that are complicated. Healthcare is a complicated business. It's a life and death business.
Right, right.
Things really go wrong. People can die. You got to be very careful.
Mm-hmm.
It's a little different than running a lot of other businesses where if something goes wrong, it may look bad, but it's not a life and death situation. In the healthcare business, it's a life and death situation.
Right.
But that's what makes it unique.
Yep. Let me. As you mentioned, that healthcare is changing a lot.
Yes.
And since the Obamacare has started, also there are some worries from the healthcare practitioners, because in our community we've got so many practitioners, healthcare practitioners,
sure.
and people are worried about the new law.
Yeah.
What is your view on that?
Well, a couple of things. One is a lot of the things that are in the new law were happening before. It isn't like nothing was happening and all of a sudden the law passed and everything is new sense. A lot of the big health systems were doing a lot of things that were eventually incorporated into the new law. So since the new law, obviously there have been more people that have got insurance, which is a good thing. What people get paid, hospitals and physicians, how you get paid has changed, and how much you get paid in some cases has been reduced. So that puts a lot more pressure on people who provide healthcare.
Right.
And in many ways, what the new law is a whole series of experiments. There is a lot that the new law says we should do that nobody knows for certain yet whether it will work or not. So everybody wants to improve the quality of care. But nobody knows for sure, how do I pay a doctor or pay a hospital to make sure that moves us towards providing the best quality. We should deliver care in different locations. So for example, there will be less care in the hospital and more care outside the hospital. And the law helps make that shift. And that's a positive thing. But it makes a lot of people upset. People who live in a community that have had a hospital, and the hospital has been there for 50 years and they love their hospital, and all of a sudden you take programs out of the hospital, they think you're destroying healthcare. Right. And some people think that the best healthcare, these are now people who live in the community, sometimes people who think that the best healthcare is healthcare delivered in a hospital, when in fact a hospital is a great place to be if you have to be there. Right. But it's not a great place to be if you shouldn't be there. Right, of course. Right? You're much better off getting care elsewhere. Yeah, right. All of these changes are disruptive. It changes people's perceptions. Sometimes people don't understand it. Government regulates a little bit too much. There's been, in my view, excessive regulation. They regulate everything, which worries me because I think in the long run, that's not a positive thing. Right. Government does a lot of things well, but when it tries to do too much,
that's a
it
problem.
undermines everything.
Right.
And over time, that balance will be corrected. It'll move. It's like the hand in a clock. It goes back and forth. You go too far, you don't go far enough. Eventually, you'll find a happy medium. But I think overall, it moves the system in a positive direction, despite all of the concerns it causes. But time will tell whether some of it actually succeeds or not. But but we were doing a lot of the things that Obamacare said that we should do. We were doing before Obamacare. So you shouldn't. My view of the world is, don't wait for the government to tell you should do something. Get out ahead and do it if you think it's the right thing to do.
So how do you fill the gap? Like, you said that the income has gone down from the hospital and a practitioner's place.
Well, you fill the gap by trying, you get more volume.
Exactly.
You expand, you get more volume.
Right.
You obviously try to be more efficient.
Right.
You look for every way. So for example, in our system, I only have one finance department. Like right now we have 19 hospitals, hundreds of other locations. Right. I don't have a separate finance department for every place. I got one finance department for everything. All legal, the business is combined. All real estate is combined. All purchasing is all combined. So there are efficiencies there, and that's the benefit of scale. If you ran facilities years ago, and run them today the way you ran them years ago, you'd be out of business today. You just couldn't survive.
Right.
So you have to be very business focused. I mean, sometimes healthcare people get upset with that word, but to me, we're running a business. This is a big business.
It is a big business.
So I got to provide great outcomes. I got to serve everybody.
Right.
But I got to be financially strong.
Right.
And I got to make those tough decisions to keep us financially strong, just like any business has to do. A little bit more difficult sometimes because, when somebody comes into a healthcare facility, in our facilities, irrespective of whether you can pay or not, we provide care to you.
Right. That's right.
But that's as it should be. You don't want to leave people without any care.
Right. Yeah.
So you got to be efficient elsewhere to make up for the gap here. And some of our hospitals do very well. Some of our hospitals don't do so well, but the ones that do very well help the ones that don't do well.
Right. Cover it up.
There's always losers and winners in every organization, and you balance it.
Like in this new law, also there is the people are finding it now that the premiums are low, but the out of pocket is huge.
Well, that's another issue. People buy insurance
Right.
thinking, well, I got cheap insurance.
Right. Exactly.
And then they go to the hospital, the doctor, they read the fine print, and they say, "Oh, I have to pay $5,000 out of pocket."
Right. Yep.
And then they can't pay out of pocket; they don't have the money.
Exactly.
And now we take care of them anyway, so
that $5,000.
I lose the money.
Exactly.
Yeah. So we won't turn anybody away. We never do. So. But people do get very surprised because they think they have a very good deal, but they realize it's not as good as it appears.
That's right.
Yeah.
Yeah. Yeah. So hospital has to suffer it at the end of the day.
Hospital has to take the hit.
Take the hit, right?
At the end of the day, that's the safety net. You go to a private doctor in the community, for the most part, they won't take care of you if yes, you can pay. I mean, some do, but a lot don't. That's why you end up in the emergency room. You go to the emergency room, you have no money, we take care of you.
Right, exactly.
And I'm glad that we do this. I'm proud that we do this. But does it put some pressure on? Sure.
Yep, absolutely.
Yeah.
Now, you are a man of ideas, right? And I heard that you also started providing insurance now.
We have our own insurance company.
Right.
Because I wanted to be able to collect the full premium. You buy insurance from me, you pay me the full premium dollar. And now I have the ability to try to make sure you stay well. I don't just treat you when you're sick.
Exactly.
Because my goal is to keep you healthy.
Right.
Because if you get sick all the time, I lose money.
Right, right, exactly. Yeah.
Right?
So
the incentives are different.
Preventive.
Right?
You
see, healthcare and hospitals forever have been paid to take care of somebody after they get sick.
Exactly, right.
So we do that today, but I also want to be able to take care of people to keep them well.
How do you do that?
Well, you do a lot of preventive work. You educate on good health. You get them to change lifestyle. You make sure they get annual physical checkups. You make sure you identify things sooner rather than later before it becomes a real problem. I mean, a lot of things are preventable.
Yes.
A lot of cancers are preventable if you get it earlier enough. Potential heart issues can be somewhat prevented if you get it early enough.
Right, right.
Instead of waiting until all of a sudden there's a disaster and now you're in the hospital and it's a couple of $100,000. And you also educate people to take care of themselves. I mean, most of the ill health results in lifestyle, behavior, lifestyle, and social circumstance. You live in a bad area, you have a problem. You don't exercise.
There's a problem.
You're overweight.
Yep.
You don't eat right. That's what creates most of the problems, especially among the area that is constant frustration is kids who are obese.
Obese, right? Obesity is a big problem.
Yeah, you have a 250-pound 12-year-old.
Wow.
You have depression, heart disease,
right,
diabetes. and that comes from lots of different issues that we have to focus on more and more and more, as you know.
Alternative medicine.
Yes.
Like, you have traditional medications
Sure.
which is available, and then
Sure.
you have Ayurveda, and you have homeopathy and other alternative.
Acupuncture and
Acupuncture and
yeah, we
chiropractic.
use all of those.
Do you agree? I mean,
Oh, I agree.
You agree?
Yes, and now it's also very, very important. We're in a very diverse community with lots of immigrants from all different parts of the world.
Right.
Their own traditions, their own histories.
Mm-hmm,
I think we have to respect all of that, and I think that there are methods of treatment that sometimes traditional medical science kind of poo-poos and says doesn't work. I think that many of those should be tried. Now, you obviously have to stop short of promoting that stuff which is in many ways can be complete quackery. That there's no legitimacy to it at all. But and that's a fine line. But I, for example, have had acupuncture, and I know years ago because I had a bad back. And I still have a bad back. I have had surgery and everything. But years ago, I went to acupuncture, acupuncturist, and a Chinese acupuncturist. And back then, the doctors would say to me, "That's crazy.
right.
It doesn't work. Why would
Right.
you go to an acupuncturist?"
Right, right.
Well, for me, it worked.
Mm-hmm.
Do I know how it worked? No,
Yeah,
but it worked.
but it worked.
I remember going to the doctor. I couldn't walk. I was laid in the back seat of a car. I was in agony. After 3 visits, I was walking around with no pain. That's what mattered to me.
Right.
It worked.
Right, right.
When I was at the state, we used acupuncture to deal with drug addiction. They put the needles in the ears. And I'm not so sure anybody knows exactly why it works. But also in regular medicine, there's a lot of stuff done that ends up working and nobody can be sure exactly why it works.
Right, works.
Right? So, you can't be a complete purist in this. I think that you've got to be very, very open to different models of treatment and different models of care. If something is demonstrated to be a complete disaster, then you've got to watch it and you've got to say no. But, that's the great thing about being in New York. I mean, we didn't
You got
know-
many different cultures, and you can learn a lot.
We have
all the time.
170 languages spoken.
Yeah, exactly. Learn
I mean,
a lot.
you travel every block, you have a different
Right.
nationality group, a
Yep.
different religious group, a different
Yep.
ethnic group.
Yep,
All with different perceptions of health.
exactly. It's
Right.
really amazing, right?
It's fabulous.
I'm telling
I
you.
mean, it's like you get a PhD a week
Yep, yep.
and you learn
really,
about all of these groups.
Really unbelievable.
Oh, yeah. I love it.
Yeah.
I mean, it would be very boring if everybody was just like me,
Yeah. Yeah. I mean, we do yoga, like I do yoga and my wife does yoga. We do yoga regularly, right?
Oh, yeah.
And yoga is a definite.
We have yoga programs. We run yoga
you
programs.
in the hospital, right?
Oh, sure.
Good. Yeah.
Oh, yeah.
Yeah, because I think it does definitely helps. I mean,
Oh,
I know
absolutely.
I have examples
Yeah.
of people.
Oh, absolutely. So I think, and more physicians
Right.
are incorporating those into the method of care. When I remember, this is like a minor issue, but years ago when I had a heart problem, the person that helped me the most was the nutritionist. Changed my diet.
Yeah, there you go.
Right?
Yep. I mean,
I
President
mean, that
Clinton.
was more impressive than what the doctor did to me.
Yep. Yeah. No, President Clinton. I mean, the same thing happened to him. He changed the diet and he started doing yoga. And
Stopped eating McDonald's or whatever.
there
he
you go.
used to
There
eat.
you go.
Right. Yeah.
Yeah. McDonald's will hate it.
No, it's not an ad for McDonald's. Although they say they have improved their food, it's the French fries.
It's a French.
It's the French
There you
fries.
go.
Yeah. That, by the way, is an issue for hospitals too. Is how we change the diet in the hospitals
Yeah,
and the cafeterias
exactly.
because people like the stuff that isn't necessarily good for them,
Yes. Yep.
and because it's tasty, it's got a salt.
Yep. See,
No.
as far as I'm concerned, the taste stays only up to here.
Yeah,
Down goes nothing. Nothing there.
that is true. That is
Exactly.
true. But the obesity issue in the U.S., the ill health issues are huge, and we can learn a lot from other countries in this regard.
I think you're right.
Yeah.
There's so many different perceptions and perspectives and ways that people do things.
Right,
And there are a
absolutely.
lot of benefits to that.
Yeah.
It's,
Yeah.
Yep.
And we have to do a better job of getting much more integrally acquainted with the various cultural groups. I mean, this is something we're working on.
Right.
We do a lot, but we don't do it as well as I'd like. We gotta, have staff that are much more from those communities, that understand those communities more. We do a lot in the area, but given how fast the diversity changes in this region, like Brooklyn is Queens and Brooklyn are two of the most diverse communities in the world.
Exactly. Yep.
You go 2 blocks, you have 2 different groups of people from 2 different parts of the world,
Yep, sir.
and they all live together. It's an amazing experiment.
Yep.
It actually
Only in
works.
US.
Only in the
Well,
US.
in India too, actually.
Yeah,
in India also.
yeah, but it's an amazing. And we have a lot of Indian docs, as you know.
Yep, yep,
The
yep.
largest single group of physicians in the New York area, physicians of Indian descent.
Yep, and I've got a lot of friends who are
Yeah.
doctors at
And
at your
I meet with them all the time. There's a group called API,
API. Yep.
and I've been honored by API. Many of our physicians, Indian docs, go to India every year and do a lot of volunteer work.
Yep.
And,
Absolutely.
they're very giving. They give back to the community enormously. And I obviously I know an awful lot of them personally. We do a lot of work together. Many of them from other communities. They go to South America.
Yep.
So there's that's what's wonderful about.
No, I have friends, who go in a group. They pick a country,
Oh, sure.
like Bangladesh or South America or Africa,
Yeah.
and they go for like 2 weeks and provide free services to people.
Yeah, I just one of my docs sent me a book, a picture book. He does it every year. He just came back, I think from Guatemala, where they did free surgery, facial surgery, and I just got it the other day, and I haven't actually gone through the whole thing yet. But he just sent me the book of all of the surgeries in the picture.
Wow.
Does it for 2 weeks. Now, in that 2-week period, he can take 100 people, 150 people, and completely change their future.
Absolutely. Big difference.
Huge difference.
Big difference in their lives.
Yeah, we also send lots of medical equipment and supplies to those countries.
Oh, okay.
So I do that on a regular basis,
Good.
which is important.
Yeah, social responsibility is very, for example, I mean, this show here,
Yeah.
this is a public service from me.
Yeah.
I don't expect or I don't make money,
Yeah.
and it costs me money, but this is for the community service.
Sure, you
Like,
get.
people like you come in and talk about these
Yeah.
issues,
Yeah.
and somebody who's outside, viewing this show, I
Yeah.
mean, they may learn something.
Oh, absolutely.
And that's the whole purpose
Yeah,
of the show,
absolutely.
really.
And it makes, and at the same time, you feel good about doing it.
Exactly.
Other people feel good about watching it.
Exactly.
And,
Yep. Mhm.
And I like to get feedback an awful lot from the community and those communities. This morning I had a meeting with Chinese doctors, and if you want to provide services in that community, you got to think about how to do it differently than
Right.
you would do if it was an Irish community
Right, absolutely.
or an English community.
Yep,
And
yep.
You can't. It's not the same
Yeah, yep.
for everybody. And from
Mm-hmm.
some parts of the world, people are fearful of authority.
Right.
They're worried about going to a hospital. They're not sure what's going to happen.
Yeah, yep.
And then you got to be very sensitive to all of those issues, which we try to be.
What do you think about Dr. Oz? Like right now, there's something
Well,
going on over there.
Yeah, I don't know him personally.
Right.
I think, and I don't know enough about the particulars of the situation. Obviously there are groups of people that have claimed that he is providing information without much scientific merit. Other people will debate that.
Right.
He argues that there's the freedom of speech issue. He should be able to talk about those things, and that some things that may not be fully proven today will be proven tomorrow. It's hard to tell. I mean, I don't think it's the most important thing happening in healthcare these days, quite honestly.
There
so,
are other things.
There's
to
a lot
worry
more
about.
important things to worry about than what
right.
Dr. Oz says on a television show in the middle of the afternoon. I've never watched the show. I'm never home. I've never
You're
watched
never
the show.
home.
My wife has watched it a few times.
Yeah.
I can't judge one way or the other.
Oh, okay.
But I look at the newspaper today, and what's going on in Nepal is a lot more important to talk about than what Dr. Oz says about some medication or some drug that he's talking about, whether it be legitimate or not. I mean,
We had a scientist here, a guest. He is a scientist at the Cold Spring Harbor Lab,
Yes.
and they're doing a lot of research on genes, human
Yes.
genes, right?
Yeah, yeah,
Genomes.
yeah.
And obviously, 5-10 years from now, the way we give medication to patient will totally change.
Yeah.
So, considering that, what is scripting in your mind? How are you going to move forward?
Well, we just did a big relationship with Cold Spring Harbor.
Okay.
We just announced it 2 weeks ago.
Okay.
So we're combining our efforts.
Mm-hmm.
We in the cancer arena, for example, we are the biggest provider of cancer services in the New York area.
Right.
We're very, very large. Cold Spring Harbor is a premier place on cancer research.
Right.
So we've done a 10-year relationship to bring together the researchers from Cold Spring with our researchers and with our clinical physicians, so that we can combine our efforts to move forward. Because I think you're going to have a lot more cures going forward, or a lot better ways to be able to treat diseases at the onset going forward with all of the mapping of the human genome.
Right.
We also have a researcher at at our place, North Shore. We have a research institute called the Feinstein Institute for Medical Research,
Right,
and the
right.
head guy there is a guy named Dr. Kevin Tracy, and he's come up with a whole new area, called bioelectronic medicine, where he believes that by manipulating the electrical signals in the body, that you can actually prevent some diseases, and maybe over time eliminate the need for some drugs.
Wow.
And he's proven this in patients in Europe.
Oh, okay.
This is a whole new area. So the amount of new experimentation and discovery that's going on is huge. And so 10-15 years from now, there will be treatments that we can't currently imagine.
Right.
Like,
Right.
I always remind people that I have 3 stents because I've had a heart issue. My whole family has got heart issues. I have 3 stents. Stents, which now people get regularly,
Right. It become normal.
were not available until 1981. So in the 1970s, if you had this problem, the treatment was go home, put your legs up and rest.
Wow.
That's all they basically could do for you.
Wow.
Today,
Interesting.
you can go in, they can go in here or in here and put a stent in.
You're done.
So now project forward and imagine what can be done 20 years from now. But the human body also will come up with defenses, and there will be other problems that we will have. But the good news is we're living longer. That's the good news. The bad news is we're having a hard time paying for it. But we're living 35 years longer today than we did 100 years ago.
Yes, exactly. Yeah.
So the success is enormous.
Yeah.
Everybody complains about everything that's wrong in healthcare. I sit there and I'm thinking, we should be very, very lucky. We're very, very fortunate and very, very thankful about all of the things that can be done today that couldn't have been done years ago.
Right.
Hip replacements, knee replacements. It's
The painless laser surgeries. This
oh,
and
yeah.
it's
Anesthesia,
totally
which
painless.
is like,
Yeah. Yeah. Yeah.
I mean, whenever you think of having a bad day, think of being a person during the Civil War.
There you go.
It's like
Yep. Civil
hard to
War
imagine.
and
World War One.
World War II
Yeah.
in
World War
England.
II.
World War II in England.
Right. Not
Was
long.
worst.
And that's just recent.
Right. Yep.
So the advancements are extraordinary. So we should be very, very comfortable and happy that these things have occurred, and it will continue to occur. And things will come out of Cold Spring, a wonderful place, and things will come out of our Feinstein. Things will come out of Memorial, out of Dana-Farber. All of these places that will solve some of the problems that we have today. But other problems will probably arise.
Right. It's always that way.
It's a
Yeah.
constant evolving process.
Viewers of this show are from South Asia, India, and Pakistan, Bangladesh.
Yes.
So give us some, what are your thoughts about our community and what do you think about us?
Well, as I mentioned before, we have a substantial number of our staff from that part of the world.
Right.
and I deal with them all the time.
Right.
One perspective, highly motivated, highly educated, the professionals that I deal with.
Right. Right.
Some of the top physicians are from that part of the world.
Right.
Very community minded, really want to give back. They work together well to help their own communities both here and abroad. It's and they represent the wonderful example of an immigrant community that I think has made the United States a better place.
Right. Oh, yep.
Both professionally and when you look at even healthcare and non-healthcare these days. If you look at all of the talent in research and technology that comes from that part of the world,
It's amazing.
it's amazing.
Yep.
We would be in big trouble.
Yep.
And one of the problems that I worry about is with all of the immigration issues for national security purposes, which I understand to an extent. But if you keep out a lot of that talent from coming into the U.S., you eventually, if you're an economic player, you'll have a real problem in the U.S.
You would have definitely. Not only healthcare, but think about technology.
The Silicon Valley.
Silicon
the
Valley
leaders
is
of
full
Silicon
of-
Valley,
yeah.
most of them are from
Yeah.
overseas.
Yeah, exactly.
If you went to our research institute, we have. I spoke to. We have 75 fellows. These are people that are have their doctorates. They're doing postdoctoral work. These are very smart people. They're researchers and statisticians and
Right.
technology gurus. I spoke to 75 of them. They work for us now. There was only about 10 of them from the U.S.
Oh, 65 was out of.
Yeah.
Wow.
All from abroad.
Wow.
Asia, broadly speaking, China, Korea, South Korea, Pakistan, India. That's the group.
Amazing.
Amazing.
Yeah.
Now, I asked the question, how many were born in the U.S.? About 10 hands go up. Those are the people in our research labs doing innovative work that will have breakthroughs that benefits humanity going
Everybody.
forward.
Right. Yeah.
And
Amazing.
the U.S. we've got to get better at a lot of this. And we got to embrace those people that want to come in because it'll make their countries better. They'll give back to the community. It'll make this place better. Many of them come here and go back, of course, as you know.
Yep.
So, I admire the entrepreneurship, the dedication to education, and the willingness to deal with their communities.
Any suggestions that we could do more? Just whatever comes in your mind.
Well, I think, and I've talked to some of people about this, is I think we can develop much more unique and discrete programs together to serve those populations better that are here.
Okay.
Right? I'm not now talking about the scientists, but I'm talking about the general populations. How do we meet their needs better than we're currently doing? And how do we get the feedback to do the outreach, to open up programs in their communities,
Right.
to have our system get much more connected to them so we can provide a better services there. If I'm opening up a site in a Pakistani community or a site in a Chinese community, how do I do it? What will attract them to that location?
Right.
I just don't want to open up a location because people may look at it and say, that's not what's
Right.
we go to.
Right.
And it also means what mix of Western medicine and what mix of Eastern medicine that you need to put there.
bring it forward.
So that kind of involvement. And we have meetings on this, and I've been in discussions about this, but we need to elevate it more.
No. You are a very busy man. I mean, running a huge enterprise and 60,000 people with all these leaders and managers and all these hospitals, and what do you do for fun? I mean, except plumbing.
Well, my fun is work.
Your fun is work?
Yeah. People ask me, do you have a hobby? I don't. I go to the gym. I like to work out. It's more psychological for me. I used to work out a lot years ago because I played lots of sports. I do less today because I have a bad back and I have to be careful. But I like to read.
Okay.
I like to study. I don't read fiction. I like to read real, autobiographies, history. I love history. I'm reading a book right now on the Ottoman Empire.
Oh, okay.
Trying to
Yep. I watched the whole show actually on YouTube.
Understand,
Right.
because it's hard.
Yeah.
There's a lot going on in that part of the world, and if
Right.
you don't know the history,
Right.
you can't understand today.
Right.
And what happened after World War II when other countries decided to divvy up those countries.
Right.
And
Right.
so I'm reading that book right now, but I like to read, and I like to go to dinner with my wife and with my kids, and that's about it. I don't play golf. I have this guilt trip, if I can't imagine wasting my time on a golf course.
Okay.
I used to years ago. I don't do it anymore. So, I don't fish. Too boring. I like hockey.
Okay.
So I love hockey. I go to hockey games ever so often. But I enjoy like sitting down on a weekend, doing work, and then reading a book,
Okay.
educating myself, trying to get educated.
Did you watch the Imitation Game, the movie? The one person who made the computer in Second World War saved probably 14 million lives.
What movie is that?
Imitation Game.
I didn't see that.
Oh, you should watch it.
You should watch that.
You should watch. I would definitely recommend you to watch it.
Yeah.
It's one person who Germans, they were sending all these messages.
Yeah.
And it was very difficult to
Oh, I heard about it. My
encrypt.
wife saw it.
Right.
Yeah.
Yeah.
Oh,
I
my
think you
wife saw
should
it.
definitely watch it.
Yeah, my wife goes to the movies.
Right. Yeah, but
She sees
find
me
time.
working and she goes to the movies.
Find time.
Yeah,
My daughter forced me to watch yesterday.
Yeah?
Yeah. So I
It's
loved
good?
it. I loved it. It's a true movie.
Oh,
It's a
yeah,
true.
yeah,
It's
yeah.
right, but it's really good.
Yeah, I know. I heard about it. No, you're right. My wife
Yeah,
did tell me
yep,
about it.
yep.
Yeah, I should go see that. But other than that, I enjoy what I do.
Good.
And, we're making progress. So I think we're doing good things. Keep raising the bar.
There you go.
And-
Yep.
And, when you're in healthcare, it's interesting because it gives you a sense of relativity. When you don't think you're having a good day, all you need to do is walk around the hospital and realize
And there
that
you
you're
go.
having a very good day.
Very good.
Yeah.
Immediately change your
It
mindset,
changes
right?
your perspective pretty
Perspective right away.
yeah.
Yeah, it was really wonderful having
you
a
so much.
conversation with you.
My pleasure.
Really appreciate your time.
Good.
You know,
Thank you. Anytime. Thanks.
thank you so much for joining us today. If you have any questions, comments, you can email me at rajmitv@gmail.com. That's again rajmitv@gmail.com. You can also watch our shows at youtube.com/Infosys International. That's again youtube.com/Infosys International. Until next time, have a great week. Thank you so much, sir.
Thank you.
Thank you.